Hello, my name is Mary Ellen Schroeder, and I am a full-time faculty at UPMC St. Margaret Family Medicine Residency. I also have a private practice in Pittsburgh, Pennsylvania, and most importantly, pertaining to the topic that I'm going to discuss here, I'm a mother of 4. And the discussion that we're going to have today is infant nutrition. And all of the cases that I'm going to be presenting are real cases that I've come across in my practice. So let's start out. The first case, this is probably something that you've seen as well. This is a 5-month-old, comes in for a well child check. His weight is 10 kilograms, and that's at the 50th percentile for an 11-month-old. But his height is at the 25th percentile for a 5-month-old, which is his age. Now, you ask Mom about his diet history, and you find out that he's been eating baby food, fruits, and juices for about a month, but she's been putting cereal in his bottle since he was only 1 month of age. Now, she also says that he has been taking 48 ounces of formula a day. So what do you tell her? This would be his growth curve here, and you can see that on the bottom his length is down at the 25th percentile, but then his weight, wow, has had a big jump in the last couple months. Now, the growth curves that we're using here are the World Health Organization growth curves for the ages 0 to 24 months. And they're a little bit different from the previous CDC growth charts, although you can still get them if you go to the cdc.gov site. And the difference is this, that breastfeeding is the norm for growth in these charts. And also, the 98th and the 2nd percentile are considered the boundaries of normal growth, whereas the previous charts had been the 5th and the 95th. Now, after 24 months or 2 years of age, then the CDC growth charts can be used. Obesity is really an epidemic, and it's not just in this country. This is a little Santiago, who is a Colombian baby, and he was very famous in the news in March of 2014 when he was plastered on the internet. He weighed, at 8 months, a whopping 46 pounds, over 3 times what he should have for his age. His mom admitted that she would feed him any time he cried. And then they did have medical intervention, and in particular from a charity called Chubby Hearts, to help give her some education. Let's look at what infants really require. Santiago had a lot of calories, but was he really getting what he needed? Infants need protein. Now, the amount of protein that they need, though, is only about 7 to 16% of their total caloric intake per day. And we'll get into that a little bit more later. Of the protein and the amino acids that infants need, 9 of them are essential, meaning they cannot produce them, that they have to actually be taken in orally. This is probably not the best way to get protein. Another one of the requirements of infants is fat. And fat should actually constitute a very significant amount of calories, over half of the calories, although the range can be 30 to 55%. And you really don't want to curtail fat intake at all in an infant, and perhaps not even in a toddler until 2 years of age. And the reason for that is because fat is needed for CNS development because of the myelinization of the nerve sheaths. What else do they need besides protein and fats? Well, carbohydrates, and they are a constituent of about 30 to 60% of calories. Now, preferably the carbohydrate that an infant receives is lactose, which is then broken down into glucose and galactose. So they need protein, they need fats, they need carbohydrates, they need water, 150 to 180 milliliters per kilogram a day. And the amount of calories that an infant needs depends on their age, and then also if they were full term or preemies. 110 kilocalorie per day for full term and 150 for preemies to catch up. So let's look at this little guy. Now, Since formula has 20 calories per ounce, and if we are estimating that the child's calories should be 110 kilocalories per kilogram a day, and we're basing it on his ideal weight, or the 50th percentile for a 5-month-old, our calculation of the needs would be as follows. 110 kilocalories times his ideal weight, 7.5 kilograms, would be 825 calories a day. Now he's getting 48 ounces times 20 calories per ounce, or 960 calories a day in formula alone. And that doesn't include the cereal and the fruit and the other things that he's getting. So clearly, this little guy is getting a lot more calories than he needs. And too much formula is actually not only bad for the child as far as obesity, but also, particularly iron-fortified formulas, can cause, you may think it doesn't make sense, but it will cause an iron deficiency anemia because it damages the brush border and you get GI blood loss. The same thing happens with cow's milk. Now again, just to show you that this is a worldwide problem, this is Chao Lei at 10 months, and he's from China, and he's a big boy too. Now his mother insists that she doesn't overfeed him and that his diet is mostly breast milk. But when this was looked into, it was found that that was perhaps not exactly correct. The new nutritional disease is obesity. And even though, let's face it, chubby little babies are so cute, fat babies are likely to be fat adults. The problem is moms often equate their success as a parent to Junior's fatness or plumpness. Oh, he's a big boy. Look at that baby. And the other thing is food has a lot more as a purpose than just nutrition. It has emotional purposes. The danger is, though, is we want to make sure that we're not treating our children like little dogs that are doing tricks and we're giving them treats. Now, even though a child may be overweight, he still may be undernourished and may not be getting the nutrients that he needs. If we look at the difference between breastfed babies and formula-fed babies, breastfed babies do tend to be leaner, and that's one reason also why the new World Health Organization growth charts are being used, because we want that to be the standard. If we look at the types of foods that kids are getting, junk foods, it starts really early. And they have done some studies that have looked at 9-month-olds. 1 in 10 get French fries every day. And when you get to 18 to 24 months, 1 in 5 in this country get French fries every day. The September 2014 edition of Pediatrics is exclusively devoted to infant nutrition and to some other topics that we'll get into in this talk, including allergies and breastfeeding. And one thing that they had said, which really shouldn't come much as a surprise to us, is that kids who drink sugar-sweetened beverages as infants and toddlers are pretty much going to stay in that habit and continue to do so at age 6 and most likely beyond. Breastfeeding. Does breastfeeding protect against later obesity? Well, yes, but depending upon the studies that you look at, the effect may be very large or very small. So I would probably say that it's a modest effect. There have been multiple studies, and the methodologies that are used will say that the effect is quite good and will last all the way into teenage years, while others say it's rather modest, if at all. This is one example of a study that was looking at rural Bavaria, and there was a dose-response relationship. The longer that the infant was breastfed, the less likely that they were going to be overweight when they were 6 years old. On the other hand, this is a study that is from Brazil, and it is showing that there really wasn't much of a difference, at least in the population that they studied. I suppose if you have cookies with your breast milk, then that's likely to increase your risk of obesity. Let's look then here at formula composition. Now this is a chart that I made up, just taking a couple different products, but you can see if you're looking at carbohydrate, fat, and protein content, it's very different from breast milk and formulas, most of which are cow's milk based. And breast milk, if you see 6% of the calories are from protein, 55% from fat, and 39% from carbohydrates. None of the other formulas, whether they're soy or whether they're cow's milk, have as low of amount of protein or as high an amount of fat in them. And the reason why protein is less in breast milk than in cow's milk is because, let's face it, we're primates. Cows are not. And a cow baby, a calf, is a parkable baby. And what I mean by that is cow babies are meant to nurse, and then they sit there and the mom goes off and grazes across the meadow. Whereas primate babies are meant to be held and carried around. And so they need to have a different nutritional component to their diet. Okay, this is just another little plug also for breastfeeding, because chronobacter outbreaks have been associated sometimes with reconstitution from powdered infant formula, and there was an outbreak in 2012. Okay, so let's go on then to another case. This is a 6-week-old, 33-week gestation, and the initial stay in the NICU was only for weight gain, didn't have any respiratory problems. Now, mom did breastfeed, but she just couldn't keep up with it after 3 weeks. And so the baby was giving premature formula at 24 calories per ounce. And then he was discharged on a premium formula of 22 calories per ounce. And she wants to know, how long should she continue this formula? It is, after all, more expensive than the other formulas. And the birth weight of this baby was 3 pounds 4 ounces. Well, again, as I said, in the hospital, the amount of calories that are in those premature formulas are higher than what you would use as an outpatient, generally 24 kilocalories per ounce. If you use those formulas later as an outpatient, it has been associated with fat vitamin toxicity, so you don't want to do that. Follow-up discharge formulas, there are various types, various brands. Enfamil has a brand, Similac has a brand, there are others. All of those generally, though, are 22 kilocalories per ounce, as opposed to the breast milk and the usual infant formulas, which are 20 kilocalories per ounce. Now, this is what the current practice is how long the baby will continue with the higher calorie formula will depend upon the birth weight. So less than 2 pounds 10 ounces, you use it for a whole year. 2 pounds 10 ounces to less than 3 pounds 5 ounces, use it to 9 months. 3 pounds 5 ounces to less than 4 pounds 6 months, and 4 pounds to 5 pounds 8 ounces to 3 months. So this baby was 3 pounds and 4 ounces. He'd get the formula to 9 months. The Cochrane Review, the most recent one we have in 2011, looked at these discharge formulas, and it did provide a higher rate of linear growth to the babies. Weight really wasn't that much different, and neurodevelopment and educational outcomes we don't have the data on. But still, this is the recommended practice. All right, this is another thing that I'm sure you come across. This is another case. Mom has a 4-month-old. There is no fluoride in her home, in the water in her home. She has one of those reverse osmosis devices underneath the sink from the previous owner. And she's inquiring about the need for fluoride drops. Baby nurses at night only, gets Similac the rest of the day, and so what do you tell her? And she wants to know, Carnation is cheaper than Similac. Can she switch? Because, after all, both of them have DHA and ARA and lutein, that nice big advertising shield on the box of the formula. And she wears glasses, and since these are supposed to be so good for the infant's neurological and visual health, if he gets it, he won't need to have glasses, right? Well, that's probably not correct. Okay. So let's look at minerals. Fluoride, well, nobody needs fluoride until age 6 months, regardless of what the amount of fluoride in the water is. Now, infants who drink powdered formula reconstituted with fluoridated water actually may be at a risk for fluorosis of the teeth, which is a staining of the teeth. So you want to be careful. who should get fluoride supplementation. The recommendations were previously based solely upon fluoride in the water, but now they're also risk stratified. Those children at high risk of caries who have low fluoride in the water should get fluoride supplementation. So again, nobody under 6 months of age, 6 months to 3 years. It depends upon if the fluoride is less than 0.3 parts per million or if it's greater than 3 parts per million. 3 to 6 years, again, depending upon if it's less than 3 parts per million or less than 6 parts per million. The level of evidence of this is level B. Now, I know what you're thinking. You're thinking, well, who exactly is a high-risk child? There are, if you go to the American Academy of Pediatric Dentistry website, which I have listed here, you'll find all of the risk factors. But the ones that pertain to this particular mom is she did have a lower socioeconomic status, and she had horrible caries. And also, unfortunately, she was putting the baby to bed with a bottle. And all of those are risk factors. So yes, once the baby hit 6 months, if those continued, which they were going to, then he would need fluoride supplementation, but not at his current age. And the problem, you might say, well, what difference does it make if mom has active caries? Well, what happens is the mother is usually colonized with the cariogenic bacteria, and the binky will fall on the ground. She'll lick it off, lick the dirt off, and stick it in baby's mouth, and that's actually a fairly common thing. All right, what about another mineral, iron? Well, it is true that serum iron levels fall in breastfed babies after 3 months of age. And it is also true that the breastfed baby gets very little iron in breast milk, but the bioavailability of this iron is fantastic. It's 50% of the iron that's in breast milk is actually bioavailable to the child. And this is in contrast to formula, where only 7% is available, and cereal, where only 4% is available. So iron supplementation isn't too much of a good thing. We used to recommend it much more than we do now, and now we actually, if the child is getting a well-balanced diet, we're not recommending it as much. And the reason is this. Some data has been shown that what happens to children when they are introduced to other foods is microbes may be introduced with these foods as well. And then the lower serum iron levels in breastfed babies and in their gut may be an evolutionary means to inhibit infection, because iron is needed as a substrate for these microbes to grow. So you only treat, and you only treat, not supplement, when it's medically necessary for an anemia or other cause. And the dose is 1 to 2 milligrams of elemental iron per kilogram per day. You can also get iron in certain foods, such as eggs. Egg yolks in particular have high iron. Now, what about those long-chain fatty acids? Linoleic acid and alpha-linoleic acid are essential in the diet. You need to have those. And there are others, that docosahexaenoic acid, that's the DHA, and the arachidonic acid, the ARA. What's the deal with that? What's up? Well, those are converted from precursor essential fatty acids, and then they are used by the infant. Most full-term infants can do this very well on their own. The problem is premature infants didn't get enough of the transplacental transmission during their shortened gestation, so they're at a little bit of a loss. Breast milk has buku bundles of all of these long-chain fatty acids. Now, we have shown that DHA and ARA supplementation has benefit for preterm infants, both in visual and neurologic functioning, although that benefit seems to taper off after 12 months. We used to say that there really was no benefit at all for term infants, but there does seem to be a slight benefit. Again, it's very modest, and it also tapers off after 12 months. It certainly is not probably worth the economic cost of the formula, which now is 30% increased from formulas that previously did not have DHA and ARA. The problem is this was so well marketed that you can't even buy formulas now that don't have this in there. And it really does make a difference when we're considering policy and we're considering food funding programs. Lutein, again, is a carotenoid compound, which is useful in eye development. And even those formulas that have 4 or 6 times the lutein that's in breast milk, the bioavailability of it is so low compared to what's in breast milk. So the baby doesn't get a lot of it anyway. But mom gets a bigger bill. Okay. All right, 4th case, we have mom now. This is not minerals now, but this is vitamin supplementation. And her baby is breastfed, age 2 months. So she wants to know, should I give my baby any supplementation? Well, vitamin D is probably the one that she's thinking most of, and it's the one that we're all thinking of, because we have had much less sun exposure in recent years because of the fear of skin cancer, and we have had a recurrence of vitamin D-associated rickets, particularly in certain parts of the country. And so we do want to make sure that the babies are getting enough vitamin E. Breast milk has very, very little vitamin D, and only 25 international units per liter. So the recommendation for infants is 400 international units a day. That means that a breastfed baby would have to drink 7 or 8 liters, and it's just not going to happen. But all formulas have 400 IUs per liter. And so if an infant is getting at least 32 ounces or a liter of the formula a day, then they're getting enough. The guidelines for vitamin D supplementation are for all exclusively breastfed infants or those who aren't getting 1 liter of vitamin D fortified formula or milk a day. After a year, the recommended guidelines are 600 international units a day. But again, most children are able to get that from foods and diet. If they're not, then we would supplement. We can get vitamin drops over the counter that have the 400 IUs per milliliter. Preemies need even more. They'll need 800 IUs a day. Vitamin B12 is very necessary for vegan mothers who breastfeed because otherwise their children can have permanent neurologic damage and they will not get enough B vitamins for brain development. Now, can vitamins be harmful? Well, unfortunately, yeah, they can. And there is some evidence that not just vitamin D itself, but when you're giving a child multivitamins, remember some of those commercials about Flintstone kids and things like that. Well, supplementation of infants and toddlers when they don't need it, when they're getting enough in their diet, can actually harm them and can be associated with later food allergies, in particular if they're formula-fed babies. And African American babies are even at a higher and unfair risk that they can also have an increased risk of asthma as well. All right. No talk on infant nutrition would be complete without speaking about breastfeeding, and we're going to spend a lot of time now talking about exactly that, about breastfeeding. This is a mom. She's coming in for a weight check with her 1-week-old nursling. Now, big baby, he was born at 8 pounds 8 ounces, and his current weight is 8 pounds 2 ounces. He was discharged from the hospital at 2 days at 8 pounds even, so he's gained back 2 ounces. She is just so tired. She's tearful. She's wondering if her baby is getting enough, and she's sleep deprived. Her nipples are so sore and they're cracked, they've even bled. Latch on is just excruciating, and the hospital sent home little samples of Enfamil, and she's really tempted to use it, but she doesn't want to be a failure. Now, to top it off, her husband is worried that her breasts are going to sag if she continues nursing, and he doesn't want her to nurse at all. Now, her mom, who did successfully nurse several babies, is supportive, but she lives all the way across the country. She does call her every day, but it's not quite the same as having somebody there. Now, she had waited quite a while in the waiting room, and by the time you go in to see her, the baby is howling with hunger, and she's looking up at you very timidly, nervously, wanting to know if it's okay for her to nurse the baby. What do you do? Well, first of all, breastfeeding has been the preferred method of feeding infants since there have been humans, and in antiquity it was the only way that you could feed babies, and you either did it yourself or you hired a wet nurse. This is our wet nurse. But anyway, the thing is, this was the only thing that you could do. It is best. It is as nature intended. But you know what? It's not an instinctual process. And in order to be successful, you have to have supportive care both pre and postnatally. This is in the hospital. This woman is getting some coaching from a nice nurse who's actually giving her some good advice. And even though I have 4 children, I had breastfed them all, they're all different. You think you know what you're doing, and you think the baby will know what he or she is doing, but every nursing dyad is different, and it doesn't work out that way. Now, why is breastfeeding so good? Well, a lot of reasons. One, it can provide total nutrition for the first 6 months of life. And it has so many things in it. It doesn't just have that water and protein and carbohydrate and fat like formula does. It has immunological, nutritional, enzymatic components, things we don't even know what's going on yet. I consider it like a tree, that there are so many branches and so many other little caveats in breast milk that we're just starting to find out. And it is big business and big science nowadays to try to figure out what's in breast milk and try to duplicate that in a formula, but you're just not going to do it. And remember how I said earlier some of those formulas that had lutein and some of the components of breast milk, even if they have lots more than breast milk does, they don't have the other things, and it's not as bioavailable, and it's just not the same. So let's look at some of the immunology of breastfeeding. How does breastfeeding protect the baby from infection? Lots of ways. One way is there are growth promoters that it makes good bacteria grow in the gut, and then it retards the growth of pathogens. Then there are some components that inhibit metabolism, but they're selective. They inhibit metabolism of pathogens, but not of good and beneficial gut bacteria. And then there are actually enzymes that chop the bacteria in half by getting weak spots in their bacterial cell walls. There are things that are double agents that are both nutritional and antimicrobial. In fact, most of everything in breast milk pretty much is like that. Some milk lipids will release free fatty acids that, again, will go and destroy pathogens. Now, you've heard of some of the other immune modulatory factors besides these chemicals. There are things that stimulate the baby's own immune system. We do have secretory IgA that is from the mom, and that goes through the baby's system and is not digested in the gut. There are things that help the baby's T cells to go out and fight bacteria more so than they would have otherwise. There are chemicals that will actually chop up viruses as well. There are those milk mucins. This is kind of a cool thing. They will make the bacteria and the viruses sticky so that they clump together and then they can't replicate. There's also interferon in breast milk. Anti-inflammatory agents, even a different set of chemicals, ascorbic acid, beta-carotene, and other epithelial growth factors that increase the protective benefits of the intestine of the baby themselves. So, what are benefits for baby for breast milk? Well, there is a modest positive effect on later cognition, and this has been shown in multiple studies. It's not that you're going to go up 40 or 50 IQ points, but most studies have shown 4 to 7, and that could be a very big difference. It may reduce the risk of adult cardiovascular disease. Certainly, it reduces the risk of sudden infant death syndrome. And if you breastfeed the baby for 16 weeks or more, 4 months or more, 5 times less of a risk for sudden infant death syndrome. We talked a little bit about obesity. There's much less allergies and lower blood pressure later in life. What about illnesses in the infant period of life? Less gastrointestinal illness, less otitis media. The really interesting thing is less leukemia and lymphomas as well. And the cool thing about breast milk is it's never the same. It's a dynamic food. You have gustatory, taste, olfactory, smell, visual sensations that are very, very different than just getting the same bottle and the same smell of the formula. You have skin-to-skin contact. I'm not saying that you can't do that with a bottle, but most people don't. But you're looking at the baby, visual, the smell, the taste. If mom had broccoli, the breast milk is going to taste a little bit different. Now, we have lots of broccoli in my house, so my kids just had to get used to it. That was too bad. All right, there's also less type 2 diabetes associated with breastfed babies. So basically, breastfeeding rocks for the baby. All right, there, I told you, this is a dyad. This is a baby and a mom. So what's in it for mom? We're going to get into that in a minute. And when we have the experts looking at this, they're saying even a few months of breastfeeding is a good thing to do. Breastfeeding recommendations are showing that babies have a much greater chance of survival, not just in third world countries, but in our country as well. And in the United States, if people would, everyone would breastfeed, we would have much less mortality in the first year of life among U.S. infants. And there is indeed a dose-response relationship to lower incidence of illness. The more you breastfeed, the more protected your baby is. Now, what is the optimum time of breastfeeding? Any breastfeeding is better than nothing. Even if it's just the colostrum in the hospital, that's better than nothing because you still get some of those antibodies and some of those immune modulating factors that we talked about. But optimally, exclusive breastfeeding means nothing else for 4 to 6 months and then continue to breastfeed until at least a year once you start to introduce supplemental foods. And is it okay to breastfeed beyond that? Of course it is. The economic impact if people did this would be huge. We would save billions of dollars in office visits for sick babies. We would also save billions of dollars in absenteeism due to childhood illnesses because parents have to stay home with babies that are sick. Now, what's interesting is insurance companies are picking up on this, and they're seeing that it costs them twice as much to care for a bottle-fed baby for 12 months as it does for a breastfed baby. So it's probably going to be another one of those quality and meaningful use measures that they're going to audit you on. Real statistics in this country, a lot of women, more than half of the women, try breastfeeding. But when we say try breastfeeding, we mean they put the baby to the breast for a couple minutes in the hospital. That's and that's literally what that means. Less than 14% continue to breastfeed at 6 months without formula supplementation, and of those, most of them stopped in 4 weeks, and most of them stopped in the very first week. If we look at healthypeople.gov and the breastfeeding objectives, some states did better than others. And the worst states, you can actually go on and get a breastfeeding report card at the cdc.gov. It's kind of cool. You can pick up your own state and you can see what's the percentage of women that start, how many are still breastfeeding at 6 months. The states that actually have less than half of the mothers that even initiate that 5 minutes in the hospital are Arkansas and Mississippi. California has the highest rate of initiation. Now, we know breastfeeding is good, but we inadvertently sabotage it. And what do I mean by that? Well, because what we do is antenatally we check the little feeding box. Oh, they're going to bottle feed. And we don't do it with a pencil anymore, but we do it in the computer. And they don't want to breastfeed, they're going to bottle feed. We may give out samples of formula. We give out pamphlets on breastfeeding without talking to the patients. Our pamphlets may have outdated information, and we're afraid to give advice. So what I'd like you to do is, instead of just checking that little box or hitting that little computer key, ask moms prenatally, what do you know about breastfeeding? Rather than just say, are you going to breastfeed or bottle feed your baby? Don't give up if she says no. Give her some information. Now, the people that are most likely to breastfeed are Caucasians, those who have higher education, those who have higher income. So the babies that are already at more risk for illness, those of lower socioeconomic status and live in poverty, really could use our help to increase their level of breastfeeding because that's going to protect them. Right. The universal cop-out, I hear it all the time, well, I don't want to make anyone feel bad about their choice. I'm a family doctor. Family doctors are supposed to be patient advocates. But you know what? You're not going to make her feel bad about their choice. And the literature has shown this. It's shown that women aren't angry when you try to support and try to encourage them to breastfeed. But there are women that after it's all said and done, they say, gee, I wish I would have breastfed. But by then it's too late. The kid's already 6 and they're done. So what we want to do is we want to encourage demand feeding. We don't want, this is what I'm talking about, giving bad advice. We gave bad advice sometimes, and sometimes we still do, and say 5 minutes per breast, 10 minutes per breast the next day, and that's really not what we want to do. We want to have demand feeding, and we want the baby to nurse until they're satisfied. It will mean that since breast milk digests a lot faster than formula does, you're going to be feeding a lot more in the initial times. And you will have night feeds. Night feeds are absolutely necessary for the baby to have enough nutrition, but also in order to increase milk production. And demand feeding really does increase milk production. Now, okay, how do you get moms to want to do this? Because after all, this is going to mean like a lot more time than just going and putting a bottle together. Well, there are some clues. These are pictures of diapers, real live diapers. Over there on the left is a breastfed diaper. Over there on the right is a formula-fed diaper. Ooey gooey, no, absolutely no comparison in the smell. Left versus right. Right is formula fed. Okay. There are other benefits too, though. Breast milk is readily available. It is always the right temperature. You don't have to heat it up or cool it down. It's sterile, it's cheap, and it comes in those cute little packages, doesn't it? Now, it also hastens postpartum uterine involution because you have the oxytocin release stimulated by sucking. And less smelly diapers, we already talked about that. It decreases the risk of postpartum thromboembolism, much less risk of breast cancer for women who have breastfed. It's emotionally satisfying, and yet you can't prop a breast and go about your stuff. You can't carry the baby with you and go about your stuff, or you can sit down and relax. Okay. Now, there's much less risk of osteoporosis too, which is interesting because initially the bone density is a little bit less for breastfeeding mothers during the breastfeeding years, but after breastfeeding is done, it rebounds to even more than those women who hadn't breastfeed. Now, not everybody loses weight, and I was a case in point, so you can't tell people, oh, you're going to lose all your baby weight faster. I actually didn't gain much weight during pregnancy, but with breastfeeding, I packed on the pounds. So don't tell them they're necessarily going to lose weight. Now, it is an economic benefit to them. It's a lot cheaper than buying formula, lots cheaper. And WIC will provide you with food for 12 months. Or longer if you breastfeed. They'll also, in most cases, get a breast pump for you. Most insurances will pay for a breast pump. And another benefit, there is decreased ovulation and less, a longer time to return to menstruation after your pregnancy if you breastfeed exclusively. But having said that, so it is a little bit of a natural child spacing, but the world's dumbest ovary is smarter than the world's smartest person, so you can't really count on that necessarily. So what are the pitfalls to breastfeeding? Well, the significant other. This woman's husband, he was he thought these breasts were his. You know, that's a common thing. And he didn't want them to be saggy, so he wasn't very supportive. A lot of women also don't have a role model. They may not have been, she wasn't really adequately counseled before she had her baby. And the first week really does hurt. Also, it takes a while for the nursing couple to get into the swing. And remember, it takes a lot more time, 8 to 12 feedings a day, than their bottle-fed counterparts. Some other pitfalls: if you don't drink enough fluid, you're not going to produce the milk. If you don't get enough sleep, you're really tired, that's going to be difficult. Stress definitely affects letdown, and women may be given misinformation, told to stop breastfeeding for jaundice or for mastitis, or they may be embarrassed. I remember I had my father-in-law come over to our house for dinner, and I actually had a very discreet outfit on when I was nursing the baby. And this is my house, mind you. And he goes, I can't believe you're doing that. And I'm like, ooh. Okay. Nipple confusion, too, from too early use of a bottle. That's also something that can be a pitfall. Plugged ducts, and we'll get into some of them. Okay. Here's why it's so hard, and I'll tell you from my own perspective. When I was breastfeeding my first child, it was really hard that first week. And I felt very betrayed because nobody told me how hard that first week was going to be. After a while, it was wonderful. But that first week was tough. We know that it's been what has been happening for years. And it used to be, if you can see on the left, there's a lady who's breastfeeding her baby on a train. Nobody else was paying any attention. This is just how it was. Okay. And I had visions. It was going to be beautiful and marvelous from day one. But this is the receptacle, and this is the extraction device. And it's a very, very daunting procedure. And women sometimes think, if I don't have breasts as big as Angeline, if instead I have breasts small like Twiggy, I'm not going to be able to breastfeed. And so they actually feel defeated before they even begin. But the only difference between Angeline and Twiggy, besides maybe some silicone, is fat. They all have the same amount of ductal tissue in their breasts. Now, the key thing is to hold the baby properly so that the mouth covers the entire areola. And I don't care how you do it, football hold, cradle hold, it doesn't matter. Nipple placement is really very important. And the baby should be facing mom belly to belly. And what you want to do is pull the baby to the breasts, not the other way around in most circumstances. We'll talk about some exceptions. And the baby needs to be latched on. And what I mean by that is that nipple's in the mouth. And there's some pretty powerful suction. You want to make sure that nipple's not pointing upwards because it's going to rub on the baby's palate, and that might hurt. And pillows are really, really helpful. If you can nurse lying down, do it. And it shouldn't hurt after that first week. If it hurts after that first week, something's wrong. And there are many, many resources that you can turn to. The hospital usually gives a lactation consultant to come in and see the patient before she goes home. And you can also talk to them afterwards as well, La Leche League. And they have different organizations of them throughout the country. So, you can see this baby, he has a good latch on. You can't see any areola outside of his mouth, and this is important. Now, she's holding him up like that. She may get a little tired doing that, so there are other things to do. She may get sore nipples over time if she lets him fall down, and then he kind of pulls off a little bit of the nipple. If you get sore nipples, and I'll tell you, that happened to me that first week, you want to expose the nipples. This is your own house after all. Okay, if you answer the door, then maybe you should put something on. But in your own house, expose the nipples. You don't need to use lanolin cream. You can if you want to. I didn't like it. You use the hind milk of your own breast. And what I mean by that, remember I said that breast milk changes its dynamic? Well, it doesn't only just change based upon what food you eat. It also changes during the course of the entire time you're breastfeeding. The amount of calcium, potassium phosphate will be a little bit different right in the newborn period than it will be 6 to 9 months later. And then the other thing, even during a single nursing session, that half hour that you're nursing the baby, it will change. Fore milk is the initial milk that comes out with letdown. It's very watery and it's high sugar content, but a lot of water. It doesn't have as much calories as the hind milk, which is where the fat comes in. And I can't tell you exactly at 2 minutes and 12 seconds you will have hind milk. It's not how it works. But the longer that you nurse, the more hind milk that you'll have. And that's why women were doomed to failure when they were previously told, oh, just nurse 10 minutes at a time, and their babies didn't gain weight. They were hydrated but didn't gain weight. Well, no wonder, because they were given bad advice. But you can express hind milk and put it on your nipples, let it dry, and it's your own house. Walk around if your nipples are sore. Okay, this is blood from the one side of the breast pump. That had actually happened to me with my first baby as well, because they were sore, they were cracked, until I got some help and I realized, aha, I have to make sure that latch on is really properly done. You may have to change position. This is a creative position that this mother has gone. If it hurts and it's sore and you can't do the usual position, that's okay. Find a way that the baby can latch on and you can still not have your breast hurt so much. You may have to do this. I mean, it doesn't matter. As long as you can get a good latch on and the baby can get nutrition, and you're only going to have to do this for a day or so until those nipples heal. You won't have to do acrobatics much after that. Pillows are really, really important. This lady has two. This pillow is called My Breast Friend. It got to the point I loved my pillow. I had this same model, and I just walked around, and if I didn't have my pillow, I almost felt like, oh my gosh, I couldn't nurse. Now, okay, so again, like I said, it's not instinctual. Here you go. You're successful. You're in the hospital. You have this baby latched onto the breast, and he fell asleep. But he's still latched on there. And there's a lot of suction. And how are you going to get that baby off there? You don't want to just go, because that's going to hurt. You use your finger to break the suction. Okay. One of the big worries that women have is my baby going to get enough? And I love this. This is from one of the parenting sites, and of course your body can make enough milk. It just made a baby. And what you want to do is look at some parameters. If the baby regains birth weight by 2 weeks, then that's great. If the baby has 5 to 6 wet diapers after the first week, 3 to 4 dirty diapers after day 4, and the baby's alert and active, you're doing fine, because you can't really measure the ounces that you're putting out. And this is showing you the difference between the fore milk and the hind milk. See, the fore milk is more watery, hind milk is thicker. All right. You can increase your milk supply by nursing. I don't understand it when sometimes people say, it's usually women, actually always women who have never breastfed, and they'll say, oh, do you nurse the baby all the time? Why use your breast as a pacifier? Excuse me? This is what you're meant to do. The more stimulation that you have to the breast, the more milk that you're going to produce. There are also certain herbs. Fenugreek is one. There's recipes for cookies that have fenugreek or fennel or other things that will increase your milk production too. Treating some common problems. Well, we talked about sore nipples, embarrassment. Like with my father-in-law. Well, you know what? Actually, I wasn't all that embarrassed with him, and I just said, too bad. So sad. You can go in the other room if you want to. But the point is women can breastfeed anywhere. You don't have to disrobe to do it. You just need a little bit of planning. If you see this lady down at the bottom, it looks like she's actually just holding her baby. This baby, you can't even tell this baby is nursing. These happen to be certain clothes that are actually particularly made for breastfeeding, but you don't have to buy expensive clothes. You can get anything that you can pull up, or you can wear vests. Are really very good. You can use one of those blankets to cover over, but personally, I think that's actually making things more noticeable. And I breastfed everywhere, on the plane, at the zoo, in the grocery store. Nobody knew what I was doing. I was just walking around. Now, you may say, okay, this is a scientific talk. Why are you talking about fashion? Well, here's why. Because you really, really need to plan. And all it takes is one bad episode for you to be so embarrassed that you might never do it again. And for instance, I still breastfed after this, but I learned my lesson to plan your wardrobe. I was at the mall, and I had my second daughter, and she was screaming, and she was hungry. And here I had worn a long-sleeve turtleneck long dress. And that just wasn't going to happen very well for us. So a little bit of planning is all you need. Same mom calls you at 1 a.m. when you're on call. She has a linear lump in the left breast, started this evening. She has no fever. What can she do? This is an urgent problem, and you need to take care of it. This is a plugged duct. It's because there's incomplete emptying of a certain portion of the breast. You can have a linear, round, or any type of shape of lump, and you need to drain this area. You need to reposition the baby. You need to massage that area from up to the shoulder, then toward the nipple. That's really important. important. It's a little hard to see on this, but this is the round lump, and this is hard. You got to take care of that, because if you don't, you're going to get mastitis, and that is a true emergency for the mom. Needs to be treated. She needs to go to bed. She needs to get rest. You will need antibiotics, and there is no need, though, to have the baby stop nursing. In fact, if you have the baby stop nursing, the baby's already colonized, you may likely get an abscess. Even if you do get an abscess, this is a little tiny abscess here, but this is mastitis. Even if you have an abscess, you don't have to stop nursing. But the only problem is the milk will taste funny. The baby may not want to nurse. But it's important to keep that breast flowing. And if you have to pump, then you pump. This is a lady who had her abscess drained, and it's kind of cool because it's messy. You'll have a little bit of leakage through the open wound of milk. And she actually used then a diaper to as a padding. All right, same mom comes in, baby's growing well, but she has burning pain in the breast, nothing on exam. The baby has oral thrush. Now, she may have nothing on exam, or she may have a nipple that looks like this and is macerated, and the baby's mouth looks like this. And so you treat both the mother and the baby with oral and with topicals. And that's that. Sometimes if you have recurrent measures, then you may have to do prophylactic treatment for these folks. Engorgement. Well, the problem with engorgement is the breast has gotten so round and so full that baby cannot latch onto that nipple. Just can't happen. And if you don't take care of that, you're going to get mastitis. You're going to have decreased milk production. So you want to actually express some milk from the nipple, soften it up, and then get the baby to latch on, and the relief is incredible. This is a baby, he can't latch onto that nipple. It's just so round, can't happen. So express some milk, soften it up, and then he can do it. And the reason why you don't want to leave the room when the mother is nursing, like this mother, that in our case, she was worried that we weren't going to like it when she was nursing the baby, and I just sat right down and I talked to her, and you want to do that for several reasons. One, because you want to let her know this is an okay thing to do in my office. Two, you also want to see if there's any problems with her nursing technique, and as there is here, you can see that the baby is not face to face with her. So he's not grabbing that nipple well. He's a nipple nibbler. Her nipples are going to hurt. And also, she's bent over. Her back's going to hurt. So her back's going to hurt. Her nipples are going to hurt. Baby's not going to get enough. And then it's going to be a self-fulfilling prophecy that she's not going to be able to continue. All right, next case. This mom's on WIC. Her baby girl is 3 months old and growing well, and she wants to have WIC pay for a new formula because she says that the baby is allergic to many others. She's tried Similac, she's tried Isomil, she's tried Posobi, now she's on Enfamil, and Grandma says that is the best because that's what she used on all of her children. And the symptoms were crying and fussy, but the mom really can't quantitate symptoms any more than that. On the same day, you have this little baby come in, 3-month-old, breastfed infant, strong family history of eczema and allergies, had red, bloody diarrheal stools when given a formula bottle when mom went back to work. The symptoms improved when breast milk bottles only were given, and then when mom didn't have enough breast milk banked up and gave formula again, symptoms came back, and the stools contain white cells. Which one has a true allergy? Well, obviously the first one is not, and that's just the power of suggestion. So you have to be careful with the old formula switcheroo thing, because frankly, even changing a cow's milk formula to a soy-based formula is unlikely to solve the problem if they have a true cow milk allergy, because 60% of cow's milk allergy babies will also have sensitivity to soy. So that's not going to work. If the baby really does have a true allergy, then amino acid formulas like Nutriamogen can be helpful, but they're really expensive, and they really smell and taste horrible. A true allergy is IgE mediated, and the baby will have wheezing, will have blood-streaked stool like this other baby did, or perhaps even worse thing. And you need to have the diagnosis that they have the symptoms when the offending agent is there. The symptoms get better when the offending agent is withdrawn, and then they recur when the offending agent is given back. And there will be blood in the stool or eosinophilic debris. Who's at risk? Well, children who have a family history, although just because they have a family history doesn't mean they're necessarily going to have allergies. If they have eczema before 1 year of age, they're at high risk for allergies to foods. In the September issue of Pediatrics, again, we're going to revisit that. They were looking at allergies in infant feeding, and they noted that a delay of solid food past 6 months, which they used to say, delay solid foods for as long as you can, or past 6 months, that is not a good thing. That's increased risk of allergies. Also, we used to say that delaying high allergenic foods like peanuts or eggs or things like that would make lower allergies, but that's not true either. It seems that you can desensitize if you have little earlier bits of introducing the foods. Now again, we're talking 4 to 6 months, not too early in the baby's life. Breastfeeding helps with allergies more as for duration rather than exclusivity. We used to tell moms if they had a strong family history that what they ate when they were pregnant could affect the baby's allergies and later, and that's not showing that it's true. There's still some debate about peanuts, but for most things, whatever the mom wants to eat in pregnancy is actually fine. You can see the price difference between Enfamil and Alimentum, which is one of those amino acid formulas, is just incredible. And this slide's actually a few years old. Big, big price difference. Okay. Now, we're going to go back to breastfeeding. This mom, 2-month-old, exclusively breastfed. She still has 3 weeks of paid maternity leave. She wants to know how she should pump milk. She wants to nurse as long as possible. Her workplace provides a lactation room. Doesn't provide a lactation room, but there is a private place, not a bathroom, where she can nurse. She has a lot of questions. She says, how long can she store her breast milk? Why, when she pumps it, does it look greenish? Can she keep it in the fridge or in the freezer? What's she going to do? And when she tries to pump, she doesn't get enough letdown to actually get the milk out, and she's really, really worried because she needs to do this to build up a milk supply for when she returns to the office. So what's she going to do? Okay. Let's see what we can do to encourage breastfeeding when moms go back to work. Well, there's break time for nursing mothers, which is in the Fair Labor Standard Act of 2010. Employers who have more than 50 employees have to provide breaks to women who breastfeed, reasonable breaks, and they have to provide a place other than a bathroom where they can pump milk. They don't have to pay the women for the time for the break, but they have to provide that. If you want to see a list of state laws promoting breastfeeding, it is down, the site is listed there. Okay. So, if it's impossible to pump at work, then make sure you pump at home. When you're nursing one side, pump the other side. That increases your letdown and increases your milk production. What you'd like to do is also refrigerate your milk. Take cold packs with you when you go to work so that when you pump, you have your breast milk refrigerated. And breast milk will last for 5 days in the refrigerator. So it's easy that you can nurse over the weekend. You don't have to pump over the weekend. And the milk you pump Friday, you can use on Monday. You want to extend your maternity leave as long as possible. A breast pump is a must, and it will pay for itself in 2 months, even if you get an expensive model. They're $250 to $350, but when you look at formula, it's actually going to pay for itself really quite easily. You want to extend this time for the maternity leave because of this. It takes a few weeks for this axis to take effect that the baby sucks, the signal is sent to the brain, the pituitary pituitary releases prolactin, which increases milk supply, and oxytocin, which causes letdown. Because remember those engorged breasts? That breast was engorged, had a lot of milk in it, but that milk wasn't going to come down unless you got oxytocin. That's what's called letdown. Letdown can be sometimes very dramatic. And sometimes when babies are nursing, they choke for a couple seconds because the milk is letting down so forcefully. What happens? The muscles around the alveoli that are full of milk will squeeze the milk out. Okay. Women worry about production, and that's going to decrease their milk supply. But we've already talked about how to tell if your baby's getting enough. They've done some elegant studies that have looked at stress, and does stress make women less likely to be able to nurse? Yes. When you go back to work on Monday after a nice weekend, you can usually pump more. By Friday, women are usually pumping less. And they did some elegant studies, too, about different stresses. They had electric shocks they would give the women, and they measured their oxytocin. I don't know how they got these women to volunteer for it. But they did. And oxytocin was less with electric shocks. But you know what the stress that was worst? Doing math problems. That was the worst type of stress. So women need to learn how to express breast milk. You can do it manually, and this shows you how to do that. You massage from the periphery of the breast toward the nipple, and then you let gravity help you and you lean over. I've had to do that a couple times, but that's not ideal because that's going to take you 30 minutes to empty each breast, and no matter what the Fair Labor Standards Act says, that is not a reasonable break, and your employer isn't going to give you that. You can have a handheld mechanical pump. Again, almost as bad. It's not going to really do the job. You can have an electric pump and pump one side at a time, and that's okay. But what you want to do is you want to get a double electric pump. Now, this is a big pump. They have ones that are so small, they're just little tiny purse size, and you can take them with you, but then you have a cooler for the milk. And I'm telling you what, this will increase your milk supply. It will increase your letdown. In my heyday, all right, in 10 minutes, I was able to get 12 ounces, moo, and I was proud of it. All right. So women should be encouraged to do that. It is well worth the expense. And if you're doing other things like this lady here, you can have a hands-free device, and I'm not sure exactly what she's doing, but yeah. It looks weird, but I'm telling you it works. Freezing breast milk. You can use the plastic disposable bottles. How long it'll keep in the freezer depends upon what the type of freezer is. If it's a freezer that's attached to your refrigerator, just a little compartment right attached to it, only 2 weeks. If it's a separate compartment, 3 months. A deep freeze, though, 6 to 9 months. Now, the milk will have different colors. It'll be a little, you can see that the colors are a little green, depending upon what you might have eaten that day. The other thing is milk will separate when you let it sit. And I have not found out how to homogenize milk. You know, no matter how you shake, you're not going to do it. It's going to separate. But I'll tell you, you need to let women know that, because I was so upset when I had my first baby and I took her to the sitter, and my liquid gold, she threw out because it had separated and she thought it was bad. So you have to make sure that women know that. All right, nipple confusion, what do we mean by that? Sucking from a breast is different than sucking from a bottle. Very different. With a breast, the baby extends his tongue and moves his tongue and his jaw in a roller-like motion. Much better for teeth development and jaw development. With a bottle, the baby uses his tongue instead as a stopper to stop the milk from flowing out. And here you can see the nipple is in the baby's mouth and it's all the way back there, whereas in a bottle the nipple stays here and his tongue here is rolling it down and would just be using as a stopper. Okay. So, a working mom who wants to avoid leakage on her clothes during work, because that's an embarrassing thing and women may not want to do that. You can put pads in. You should wear a vest. You don't want to place your arms under your breasts and lift up, because then you'll have milk going across the room. But you can put a clipboard in front of your vest. You can cross your chest. Okay. All right, this is our last case. This is a healthy child, 8 months old, crawling and looking at 7-year-old sister's food. And mom wonders, what food is it okay to feed? And can't she just have skim milk like everybody else in the house? That formula and those baby food jars are so expensive, and she eats a whole lot. Well, When do you wean? If you're a breastfed couple, then a mutually acceptable time is best. I actually nursed all of my babies well beyond age 2, and actually when they gave it up, I was more upset than they were. But sometimes circumstances happen and you have to wean abruptly. Babies may get mad. They may not want to take a bottle, so you have to watch out for dehydration. Teeth are no reason not to nurse. Babies will learn quite quickly that if they bite, they will not be able to nurse. And all you have to do, you have a firm no, because they're sitting there and they're chewing with their teeth and it hurts. You have a firm no and pull them off. And they learn really quickly, even babies of a few months old. My oldest son was the only one that took him a couple days, but he learned the lesson too. No bite, no bitey, because you bitey, no booby, and he figured it out. All right, this is a woman. This is from For Better For Worse. She's nursing. Ouch, and she hands her off to the grandma, and the grandma says, "An important lesson in life, Meredith: never bite the gland that feeds you." But anyway, the best time to introduce solids is 4 to 6 months of age, and here's why. If you introduce them too soon, before 3 months of age, or if you introduce them too late, after 7 months of age, then you have an increased risk of diabetes, allergies, and celiac disease. So you want to get that 4 to 6 month window. And frankly, babies aren't ready before that time, because you try to stick a spoon in there and they have what's called an extrusion reflex, or they go nah, nah, and they stick their tongue out and the spoon's not going to go in there. After a while, though, they get the idea and they suck it in there. Okay, this is baby. She's like, no way, Jose. That's weird stuff. And cereal, we talked about this before, not before 3 months, and not after 7. That window is important because you have a much greater incidence of allergies if you are too soon or too late. Now, there are some babies that have reflux, and they may need to have cereal in the bottle, but we're talking about if there's not other medical indication that they need that. Okay. Schedule of foods. The important thing is this is one possible schedule of foods, but what's really important is you only introduce one food every 3 days and don't introduce another one. If they've already tolerated a previous food, you can still give those, but you don't want to introduce 3 or 4 things at once, because if they have a reaction, you're not going to know what did to it, what caused it. Meats, eggs, fish, 9 months, but even so, this is actually starting to be in question. Is it okay to introduce those things a little earlier? And yes, it probably is, and may have less allergies associated with it than waiting later. We already talked about this. The other thing you want to do is give foods based upon development. And what I mean by that is when they can pick something up, Cheerios, that's a nice thing. That's also giving their development as well as giving them some nutrition. And besides Cheerios mush up in their mouth, they can't really choke on it. Juices, nobody really should get that much juice. No more than 4 to 6 ounces a day, and wait till those teeth have erupted. Whole milk after age 1 year, because they need that demyelinization. You don't want to curtail fats. In certain high-risk families where there's a lot of cardiac disease, then they have done some studies that 18 months is probably okay to start lower fat milk. Toddlers, they are at the stage, what's their favorite word? No. No. All right, they have control many times over what they eat, but that doesn't mean you have to be their short order cook. They look at new foods as strangers, and so they want to test them, and they want to test their behavior. They want to test limits. And we all know that actually infants and toddlers get a lot of nutrition from their foreheads and their chins. That's where they absorb it the most. But parents, sometimes it's easier to give in and give them what they want. You don't have to do that. Feel comfortable setting rules. They should eat when you eat. And you don't have to just make them certain things because that's what they want. A wide variety of foods are things that they should have. Eat where everyone else in the family eats and when everyone else eats. And they'll get hungry, don't worry. And turn off the TV during mealtime. Now, I always get the question, chocolate? Well, we haven't really studied when chocolate is the best time to give it, but my personal opinion is that it's nature's perfect food after breast milk. And this, I'm going to be honest, this is actually my daughter who, I swear she grabbed it off the table, a Thin Mint. She was 6 months old. She was a woman. It was chocolate. It's a rite of passage, and there you have it. So